Hello, my name is Dr. John Matthews. I'm the GP Clinical Chair of North Tyneside Clinical Commissioning Group. The NHS has had a busy year last year and North Tyneside was no exception. The Clinical Commissioning Group has responsibility for making sure that quality of standards are maintained, and despite the busy year we were still successful in North Tyneside in meeting the targets for waiting times in A&E and for patients going to hospital and for cancer waits. We also saw a reduction in the waiting times for psychological services, and also we saw an increase in the number of patients diagnosed with dementia, which meant that these people could access improved services. We are aware that the NHS is under increasing pressure due to increasing demands and funds are limited. The Clinical Commissioning Group has a budget of about £300 million, and last year we exceeded this budget by about 6.4 million, which is 3%. The main reasons for this overspend were an increased use of hospital services, particularly urgent admissions, and also the costs of nursing care for people with long-term health needs. Prescribing costs were another cause. This is not a sustainable increase in spending, and so the Clinical Commissioning Group has had to institute a recovery plan to bring ourselves back into financial balance. The main focus of this recovery plan is to look at reducing hospital expenditure and making better use of the money that we're spending. So the main things we're focusing on is shared decision making with patients so that we agree on the best use of the resources that are available. We're looking at integrated care where we're working more closely with health and social care so that patients' needs are best met by the right service. So for example, sometimes elderly people go into hospital because they don't have enough support at home, and if we work more closely with social care, they can be looked after at home together with support from hospital-based services working in the community. We're also keen to make the best use of our drugs that we prescribe, which means reducing wastage and, where possible, buying drugs from pharmacists rather than prescribed drugs. So in summary, we have very good quality care services with high levels of patient satisfaction in North Tyneside, but they are costing us too much. In the coming year, we're going to be looking at making better use of those resources by working together, and we'd like to engage with our partners, that's in hospital and social care, as well as our patients in doing this.